Hi, this short video provides an introduction to measures that can be taken to mitigate the risks posed by COVID-19 in the workplace. My name is Don Taylor, and I'm a professor at the School for Workers, a department at the University of Wisconsin-Madison with more than 90 years history of providing education and consulting to workers, unions, and employers in Wisconsin and across the United States. This video focuses on workplace controls that can be implemented to mitigate COVID-19 risk. The content is based on the Osha publication called Guidance on Preparing Workplaces for COVID-19. For employers, we hope this video is helpful in your efforts to mitigate infection risk in your business operations. For employees and unions, we hope this video assists you in pinpointing relevant safety controls that you can urge your employer to adopt. Of course, neither employers nor employees should rely on this video alone. All should examine the OSHA guidelines we are summarizing here, available for free download from the OSHA website. Before we discuss the OSHA guidelines, we should note that there are some broader OSHA standards that apply. The OSHA General Duty Clause requires employers to provide a workplace free from recognized hazards likely to cause serious harm or death. OSHA also has a Personal Protective Equipment Standard, which requires employers to conduct an assessment, provide appropriate PPE at no cost to employees, and train employees on the donning and doffing, maintenance, storage, and replacement of PPE. There is also an OSHA Sanitation Standard that gives employees the right to go to the bathroom whenever needed, including for hand washing. And there is a right to refuse dangerous work, but it has detailed requirements that are difficult to meet. At this time, there are no OSHA standards specifically related to airborne infectious disease. So, beyond these existing standards, we should look at the agency's guidelines, or recommendations. For this, we'll return now to the OSHA publication Guidance on Preparing Workplaces for COVID-19. The OSHA publication contains a list of steps all employers can take. We should note that in unionized workplaces, none of these steps should be implemented unilaterally by the employer. All should be undertaken jointly through labor management consultation or negotiations. The steps are: all employers should develop an infectious disease preparedness and response plan, centered on analyzing how and where workers might get exposed, the risks, and controls to address them. All employers should implement basic infection prevention measures, such as promoting hand washing, increasing distance between employees, and enhanced cleaning practices. Of course, promoting hand washing means providing the means to do so, and increasing distance between employees might require re-engineering the workspace to some degree, even if temporarily detrimental to efficiency. All employers should develop policies and procedures for prompt identification and isolation of sick people. Employers should have specific plans for what to do when a sick employee is identified. And while there is an obligation to respect the privacy of sick individuals, employers also have a responsibility to communicate with other employees about the presence of the virus in the workplace. Employers should develop workplace flexibilities and protections, implement them, and communicate them to employees. Both OSHA and the CDC urge employers to develop policies that encourage sick employees to stay home. This includes suspending or eliminating attendance systems that penalize employees for absences, and could also include additional banks of sick leave and other measures that incentivize healthy behaviors. Lastly, all employers should implement workplace controls. Controls are measures that eliminate or reduce risk. Because some are more effective than others, they can be ranked in categories of effectiveness, and this ranking is known as the hierarchy of controls. We'll spend the rest of our time talking about that. The hierarchy of controls is a tool for employers, workers, and unions to use in analyzing their workplace and selecting the controls that apply. The higher in the hierarchy, the better, because the levels are ranked by effectiveness. A risk mitigation plan would involve a mixture of measures from multiple levels of the hierarchy of controls. I will mention the top two levels just briefly because they aren't very applicable to an airborne viral pathogen hazard like COVID-19. The top level of the hierarchy is elimination, or the physical removal of the hazard. This isn't really possible in the case of COVID-19, unless and until we can test all employees at the door and get instant results. The second level of the hierarchy is substitution, or replacing the hazard with something else. This would apply, for example, in the case of a dangerous chemical, which we could possibly replace with a less dangerous chemical, but it's not very applicable to an infectious disease. When we reach the third level of the hierarchy, we have the ability to explore some controls that are applicable to the COVID-19 situation. Engineering controls are the use of safeguarding technology to prevent the hazard from reaching the worker. These types of controls reduce exposure to the hazard without relying on workers to change their behavior. General examples include installing high-efficiency air filters, increasing ventilation rates, physical barriers like plastic sneeze guards, and automatic doors. Administrative controls involve changes in workplace policies or procedures and require employee behavior changes. For this reason, they are less effective than engineering controls, which are physical changes to the work environment. Administrative controls could include flexible leave policies, alternating days or extra shifts to minimize contact between employees, discontinuing non-essential travel, and expert training on risk factors and protective behaviors. Personal protective equipment controls can be very important, but are generally not as effective as engineering and administrative controls. PPE that are applicable to the COVID-19 hazard include gloves, goggles, face shields, and masks and other respiratory protection. OSHA provides even more specific advice on workplace controls based on category of risk. To illustrate this, they utilize a different pyramid, the Occupational Risk Pyramid. Very high exposure risk jobs are those in healthcare settings, laboratories, or morgues with high potential for exposure to the coronavirus during specific procedures. This group includes healthcare workers performing procedures on known COVID-19 patients, healthcare or lab personnel handling specimens from known or suspected COVID-19 patients, and morgue workers performing autopsies on the bodies of people known or suspected of having COVID-19 at the time of death. High exposure risk jobs include healthcare delivery and support staff exposed to known or suspected COVID-19 patients, medical transport workers moving known or suspected COVID-19 patients, and mortuary workers involved in preparing the bodies of those who are known or suspected to have had COVID-19 at the time of death. For workers in the very high and high risk categories, OSHA first suggests that employers follow the steps all employers can take reviewed earlier in this video. In addition, a number of engineering, administrative, and PPE controls are recommended. Engineering controls include appropriate air handling systems, isolation of COVID-19 patients, and special biosafety precautions. Suggested administrative controls include policies that reduce exposure, posting of signs, enhanced medical monitoring of workers, job-specific training, and psychological and behavioral support. For PPE controls, most workers in these categories will need gloves, a gown, a face shield or goggles, and either a face mask or respirator depending on their job tasks and exposure risks. Medium risk jobs are those that require frequent or close contact with people who may be infected with the coronavirus. This might include workers who have frequent contact with travelers or have frequent contact with the general public, such as in high-volume retail settings. For workers in this category, OSHA suggests that employers follow the steps all employers can take and suggests additional engineering controls, such as physical barriers, and administrative controls, such as limiting the public's access to the worksite and minimizing face-to-face contact. PPE controls can include gloves, gowns, face masks, face shields, and goggles. Lower exposure risk jobs are those that do not require contact with people known or suspected to be infected with the coronavirus, nor frequent close contact with the general public or coworkers. For workers in this category, OSHA suggests that employers simply follow the steps all employers can take, with no additional engineering, administrative, or PPE controls suggested. I hope this review of the hierarchy of controls and their application in the COVID-19 situation has been helpful to you. I encourage you to obtain the OSHA guidelines and implement as many as you find relevant. Employers should use the guidelines to maximize the measures you take in your business in order to mitigate the risk of infection. Not only is it the right thing to do, but it makes business sense as well, because uncontrolled infection will lead to levels of absenteeism that are unsustainable for your business. Workers should download the guidelines, review them with your coworkers, and use them to think of ideas you can bring to your employer for improving controls in your workplace. Unions should use the guidelines as the basis for a full review of practices and controls in your workplace and develop proposals for immediate negotiations. We at the School for Workers stand ready to assist you and your organization with this and other subjects. Thanks for spending this time with us, and feel free to contact us if you have any questions. We hope you and your family remain safe and secure.